Hey guys, this is Dr. O'Donnell here. Hope y'all have been well through this, incredible time in our lives with COVID-19. I want to give you some updates on what we're doing in the practice as we open back up Monday, May the 4th, incidentally, which is Star Wars Day for all the Star Wars lovers out there. And want to go over some things with you just so you know what to expect as you come back to our office. Things are going to be different, obviously, as they are everywhere, and you will be greeted by someone at your car from our office that will be in full garb, mask, face shield, gloves. The waiting room is going to be closed, so don't try and come into the office because we won't be allowed to let you in, essentially. So, um, as I go over these things, I'm going to be referring to some notes. So if I kind of look down, I'm looking at notes just so I know I cover everything, okay? The Board of Dental Examiners met yesterday and they allowed us to open back up. And that is a good thing as I'm ready to see you guys, my patients, and hopefully some of you are ready to see me. I know y'all have been great letting me field emergencies over the phone through this time. Um, it's been challenging. I think the staff is ready to come back. I'm definitely ready to come back and do some work. So I'm excited to see you guys, and I appreciate every one of you being patient with us. So thank you. Emergencies. If you have a dental emergency or you have a problem, please know, call our office. And what we're going to do is we're going to do teledentistry. That's something that is going to be new to all of us and is going to be uncomfortable. But what we're going to do, we're going to get all the information we can from you over the phone. They're going to give me the information and I will call you back over the phone so we can actually see if we can't figure out what's going on over the phone so we can get you in the office for the appropriate treatment. In the past, we've always tried to bring you guys in, diagnose what was going on, give you a treatment plan and do the treatment. We are very limited on how we are going to be able to see patients for the near future. I really don't know if things are ever going to get back to normal. So if you have an emergency, don't hesitate to call the office. I will call you back as soon as I get the information and I have time to get on the phone, okay? Because we're going to be treating patients. The office is not going to be as busy as it was. We're not going to be bringing patients in right and left. We can't. We have to, make sure we follow the 6 foot rule, which when you come into the office, you'll be taken directly to the operatory we're going to be working in, and then you're going to leave that operatory. If everything goes the way I'm hoping it will, you're not ever going to see another patient in there. You'll see me, you'll see the person that brought you in, and then they'll escort you out, okay? We'll be doing a questionnaire before we bring you in the office. I know some that have appointments Monday and Tuesday have already been called and asked questions. We're also going to be taking your temperature by a non-touch thermometer. I bought these thermometers. I can point it at your forehead 4 to 5 inches away. It's going to give me your temperature. If your temperature is 100.4 or below, we'll be able to see you, and symptom-free, obviously. If it's over 100.4, we're going to have to refer you to the physician and see what we can do. I know, I don't, some of you are probably going, what are they doing? I'm following the rules set forth by the Board of Dental Examiners because I really want to be open. Because if I don't open, I'm going to work myself to death doing chores around my house. And I enjoy dentistry way more than I enjoy mulching and painting and doing all this stuff. So but please bear with us, okay? When we get you in the back, we're going to have you rinse with hydrogen peroxide for 60 seconds, if you can tolerate that. They're showing that reduces bacteria and things. We do things like this before we place implants, so that's nothing really new. Really, that's about it on the patient side. We're going to have a little hand sanitizer station set up at the front door. You'll squirt your hands with the alcohol-based hand sanitizer. We'll take you right back to your room, do what we need to do, and get you right out of the office, okay? We have always followed CDC guidelines on infection control. We've always done a really good job with our cleaning of the office. I think that one thing that you guys have always said is we keep the office clean, and we want to keep it even more clean. It's an old building. Often patients talk to me about the building, and it is built in 1987. We're always updating, always trying to keep it nice, and we're going to keep it clean as well. Any guidelines that they put forth from the CDC or anything that they ask us to do, we're doing. We're going to be wearing face shields. You're not going to see us without something on. So this may be the last time you see my face for a while, unless we do some sort of video conferencing. So if I'm scaring some of you, sorry. But anyway, I'm looking forward to seeing you guys. I hope that y'all have been well. I honestly, I haven't met anybody or talked to anybody that's gotten COVID-19. I know I don't want it. I know you don't want it. But I also want to get back to life as normal as possible as we can. And this is the first step. And I really look forward to seeing you guys and putting some normalcy back in my life. If you have any questions, call us. We're going to have a couple of staff members in the office tomorrow getting ready for next week. We're not going to be seeing patients tomorrow. We will see patients starting Monday. And thank you guys for letting us take care of you. I really appreciate it, and I know the staff does, and we're all looking forward to seeing you, and I'll talk to you soon. Thank you.